Hello, my name is Regina Brown, and today I want to discuss the Tuskegee Syphilis study as a teaching example to explore important concepts related to the ethics, law, healthcare policy, and cultural competency. The study is widely recognized as one of the most unethical research experiments conducted in the United States. By understanding what happened and why it was wrong, healthcare professionals can better recognize the importance of ethical decision making, patient rights, and trust in healthcare. The Tuskegee Syphilis study began in 1932 and was conducted by the U.S. Public Health Service. It took place in Macon County, Alabama, where researchers recruited 600 African American men to participate. Many of these men were poor sharecroppers with limited access to health care, which made them especially vulnerable to being taken advantage of. The stated purpose of the study was to observe the natural progression of untreated syphilis over time. Researchers divided the participants into two groups. A total of 399 men had syphilis, while 201 men served as the comparison group. Participants were told they were receiving treatment for bad blood, which was a common local term used to describe a variety of illnesses. In reality, no effective treatment was provided. Instead, researchers were observing the long-term effects of untreated syphilis. One of the most troubling aspects of the Tuskegee study was the deception used by researchers. Participants were never told they had syphilis, and they were not informed that they were part of a research study. Even after penicillin became widely recognized as an effective treatment in the 1940s, researchers continued the study and withheld care from the participants. The Tuskegee study continued for decades before it was finally exposed. A public health worker named Peter Buxton began to question the ethics of the research and raised concerns within the system. When those concerns were ignored, he took the information to journalists. In 1972, the story became public, which led to widespread outrage. Soon afterward, the study was officially terminated. One of the most serious ethical violations in the Tuskegee study was the lack of informed consent. In both healthcare and research, informed consent means that individuals understand the purpose of the treatment or study, the potential risks involved, and their right to refuse participation. These basic standards were not followed in the Tuskegee study, leaving participants unaware of their diagnosis and stripping them of their ability to make informed decisions about their own care. Another major ethical concern in the Tuskegee study was the exploitation of a vulnerable population. Many of the participants had limited education and very little access to medical care, which made them especially vulnerable. Researchers took advantage of these circumstances along with the racial inequalities present at the time. Today, research ethics place a strong emphasis on protecting vulnerable populations so that this type of harm is not repeated. The Tuskegee study also raised serious legal concerns. Researchers failed to obtain informed consent and misled participants about their medical condition. While many of these actions were not clearly prohibited by law at the time, they were deeply unethical and later helped shape modern healthcare laws. This case highlighted the need for clearer legal protections for patients. Today, those laws place a strong emphasis on patient rights, including the right to accurate medical information and the ability to make informed decisions about care. However, the impact of the study went far beyond legal change and continues to affect trust in healthcare today. As Dr. Martin Luther King Jr. emphasized, inequality in healthcare is one of the most serious forms of injustice. The Tuskegee study didn't just harm the men involved, it had lasting effects on entire communities. It contributed to a deep and ongoing mistrust of the healthcare system, particularly among African American populations. That mistrust still influences healthcare decisions today, from delayed care to hesitation around medical research. At the same time, it has also brought greater awareness to healthcare disparities and the importance of addressing them. For healthcare professionals, understanding this history matters. It reminds us why ethical practice, clear communication, and cultural competence are essential to rebuilding trust and providing respectful, patient-centered care. The public reaction to the Tuskegee study led to major reforms in research ethics. In response, the National Research Act established new federal oversight for research involving human subjects. The Belmont Report later outlined key ethical principles, including respect for persons, beneficence, and justice. These principles help guide how researchers treat participants and ensure that their rights and well-being are protected. Today, institutional review boards review research studies to help ensure that participants are informed, protected, and treated ethically. Today, research involving human participants must follow strict ethical guidelines. This includes informed consent requirements, which ensure that participants understand the purpose of a study, the risks involved, and their right to choose whether to participate. Institutional review boards review research proposals before studies begin to ensure that risks are minimized and that participants are protected. In addition, federal regulations and professional codes of ethics provide clear standards for how research should be conducted. These safeguards were put in place to address past failures and to reduce the risk of similar ethical violations occurring in the future. Healthcare professionals can help prevent similar ethical failures by prioritizing transparency and patient autonomy. This includes clearly explaining medical treatments, obtaining informed consent, and respecting patients' rights to make decisions about their own care without pressure or coercion. It is important to follow established ethical and legal guidelines to ensure that care is provided responsibly. In addition, improving cultural competency can help providers better understand and support communities that have experienced historical injustices in healthcare. Building trust with underserved populations is essential to improving health outcomes and ensuring that patients feel respected and heard. The Tuskegee Syphilis study remains an important reminder of consequences of unethical research. It represents a major failure in both ethical responsibility and respect for human dignity. The public response led to significant reforms that helped shape modern research ethics, including stronger protections for patients and greater oversight of research. However, the impact of the study continues today, particularly in the form of ongoing mistrust in healthcare among affected communities. Understanding this history is essential for healthcare professionals. It reinforces the importance of ethical decision making, transparency, and cultural competence in building and maintaining trust with patients and communities. It reinforces the responsibility healthcare professionals have to build trust through ethical, respectful, and patient centered care. Any questions?